Hello, everyone, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a quick few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. I'd like to now introduce today's speakers, Dr. C. Chen, Physician Director on the Practice Sustainability Team at the AMA, and Taylor Johnson, Manager, Physician Practice Development at the AMA.
Thanks for joining us today. Before we begin our presentation, I'd like to discuss the physician's role in managing the revenue cycle. As physicians, we typically don't get much education in medical school or residency regarding the entirety of the revenue cycle. Aside from the basics of billing and coding, it can be daunting to understand all those details, but we don't really need to become experts in the revenue cycle. We just need to understand enough to ask the right questions and then lean on experts in our own teams. By introducing the revenue cycle as a whole today, we hope to give you a good general framework for which to ask those questions of your team members. At the end of the day, a physician owner and leader in an independent practice reaps the rewards or suffers the consequences of a poorly managed revenue cycle. Speaking of leaning on an expert on my own team, Taylor, please take it away.
Thank you, Dr. Chen, and thank you, Sumbul. So this is our agenda today. Really high level, we're going to go through the revenue cycle. What exactly is revenue cycle management? We have 8 steps to the revenue cycle, and then some ways to optimize your revenue cycle through clean claims and denial management, and then some practice strategies and successes in revenue cycle management. Sumbul, next slide, please. Let's start with a level set on the healthcare revenue cycle. When we talk about the revenue cycle in healthcare, it's the protocols that enable payments for medical services from a healthcare facility or physician. The cycle starts with patient registration and includes insurance verification and prior authorization, medical care provided to the patient, claim submission, and reimbursement from the patient's insurance company or the patient themselves.
Thank you, Taylor, for that review. This slide, I just want to really emphasize that this is the key takeaway from this presentation. If nothing else, you should look at this and really quite understand the framework as best you can, because I think it will allow you to ask the right questions for your own practice. Next slide.
I think that's really important, C. And when we talk about revenue cycle management, what we're really talking about is optimizing the revenue cycle process within your practice so that you can maximize practice revenue and ultimately improve care and outcomes. Next slide. So as I mentioned before, we're going to break down the healthcare revenue cycle into the 8 steps here that are listed on the screen, and we'll go through each of these steps in the next slides. Step 1 is patient registration. And this is when the practice collects the basic patient demographic information and inputs that into the system. I wanted to highlight some of the common errors in this step that include incorrect or missing date of birth, insurance ID numbers, and nicknames entered instead of legal names. This frequently happens with the group number is missing and it's listed on the insurance card. If there's a middle initial missing, that should be included in the patient's demographic information in the practice's system if it's included on the card, and the guarantor information if the patient is not the primary person listed on the health insurance plan. If any of this information is missing or incorrect, it will create problems in the following steps. So it's important to ensure accuracy from this point. Next slide. Insurance verification is the next step. This is when the practice contacts the patient's insurance company to verify the patient has active insurance the physician is in network with the insurance plan. And then the practice moves into the patient-specific coverage for any testing, exams, and procedures the patient may need. This is also the step when the practice should check for prior authorization and any patient financial responsibility for the services provided by the practice.
I'd like to, thank you. I'd like to go through an example from my own experience regarding this. In one of my practices, we switched from a local or in-house billing process to a centralized regional business office to handle many of the steps of our revenue cycle. However, after a while, after the switch, we noticed that our accounts receivable wasn't in line with what we had previously expected with known patient volumes. So I teamed up with our practice manager and we started doing some digging. And it turns out that the central business office wasn't actually getting prior authorization, but they were just using a payer matrix to make sure that our treatments were covered. So again, they weren't getting prior auth. They were just saying, hey, we look at the matrix, treatments are covered, you're good to go. This was totally different than our previous workflow. And when the claims were actually denied, the office would just charge it off and we wouldn't actually receive any notification whatsoever. So after digging in, we eventually did get the problem fixed, but not before many thousands of dollars were lost. So really want to emphasize some of these steps, especially prior authorization.
And I think, see, one of the things that we're going to talk about in step 3 in the patient check-in and check-out process is the different steps that the front desk actually has to take in this process. And so on the screen, we have an example, but the key takeaway is really the communication between the front desk staff and whoever handles the prior authorizations or referrals for the practice. It's important that the practice identifies a workflow for the two departments to easily communicate this information to each other, so that when the patient checks in, the front desk staff knows exactly where to look to ensure that the insurance was verified and access any other information related to co-payments or deposits that need to be collected at the time of the appointment. And then for the checkout process, the front desk staff should have a workflow for notifying the prior authorization or referrals department when the patient is coming back and what the patient is coming back for. This then allows that department to keep a list and triage any prior authorizations or referrals that they need to check on before upcoming appointments.
I think that's absolutely right, Taylor. This step really highlights that communication between that billing office and the front desk. I think if we had a good process and the business office actually correctly communicated things, we could have corrected that situation quite a bit sooner.
And now moving on to step 4 is the medical coding and billing that happens after the patient's chart note for each visit is finalized. This is an example flow chart on the screen that gives a good picture of the different steps that the administrative staff at your practice goes through when adding and reviewing the coding and billing related to each date of service. The coding and billing team should ensure that all of the required elements are documented in the patient chart to bill for specific services. For example, each CPT code must be associated with a diagnosis code, and the administrative team should ensure that the CPT codes are associated with the correct diagnosis code as they're listed in the chart, and then add any modifiers, update any of the CPT code units as necessary. And this is the piece that I really want to highlight. If there are any discrepancies, the administrative team should be working with the physicians directly to make corrections. The administrative team should not be changing anything without the approval of the physician or other clinicians on the team. Coding errors are the most common reason claims are denied, so it's crucial to go through this step before the claims are even created.
Taylor, I think this is definitely the step probably where most physicians interact most with the revenue cycle and their billing staff. I think as clinicians, we need to be really comfortable and familiar with this step to get paid. However, as a physician owner or leader, I think we can't lose sight of the fact that the other steps are required as well. So we'll go through the next few steps as well.
Exactly. The next step is actually creating and preparing the claim for submission within your EHR or practice management system. When we talk about medical claims, we're referring to a bill that your practice or other healthcare facilities submit to a patient's insurance for medical care that was provided to the patient. This is going to vary based on the systems that you currently have in your practice. So on the screen is a very general flow chart that explains what this process looks like overall. In this step, we're going to discuss something called a clearinghouse. And in healthcare, a clearinghouse is an institution that electronically transmits different types of medical claims data to insurance carriers and then electronically transmits reimbursement information from insurance carriers to the facility or physician practice. The biggest takeaway from this step is that the billing team should verify that they're not sending incomplete or incorrect claims to your clearinghouse. These incomplete or incorrect claims could include a single box that was unchecked on the claim in your system, missing prior authorization number, or even a missing taxonomy code or NPI number for the billing provider. Different insurance companies require different information on claims to process them, so it's important that the billing staff understands what information each company requires. Incomplete or incorrect claim forms will result in a claim rejection or denial and just delay reimbursement for services longer than needed. Next slide, please. Now, once the claims have been submitted to the clearinghouse, it's so important that the practice monitors payer decisions regarding those claims. On the screen, we have another example flow chart that highlights some checks and balances for practices as they're implementing or redesigning their claims process. When the practice monitors claims, the first step is to ensure that claims were submitted to the clearinghouse. So start there and ensure that there are no claims in an unsubmitted or equivalent status within your system. And I just want to give the disclaimer that these claim statuses that we have listed in this example flow chart, they may differ based on the software that you currently use. So these are just examples, but there should be an equivalent in your system. But once you've addressed those unsubmitted claims, look at any claims that are in a payer denied, payer rejected, or clearinghouse denied or rejected status. This means that the claim had an error that needs to be addressed before you can resubmit. And finally, the last thing that you're going to look at are any claims that have been in a submitted or accepted status for longer than 30 days and start with the oldest date of service first. This usually means that there's an issue with communication either between your system and the clearinghouse or the payer in the clearinghouse, and at some point, something didn't get transmitted correctly.
So I think in my anecdote, our business office didn't really notify our clinic properly of denied claims and the reasons behind them. So because of this, we had a bunch of digging to do before we found our problem. If we had a better system like you've defined, monitoring those payer decisions of the submitted claims and the problems if they were not accepted, I think we would have found that problem way sooner.
And I think that's really important to highlight because most of the times, if there was a change in something that a payer requires or prior authorization for specific procedures, you're going to see an increase in your denials. And if you had missed some communication from a payer about this, the denials are really the first step that the first time that you're going to be notified and realize that something needs to be changed in your workflow. Next slide, please. Step 7 is preparing the patient statements or bills that go out to the patients. The practice will receive electronic remittance advice or an explanation of benefits from the insurance company that explains what was covered for each of the CPT codes on the claim, what the patient is responsible for, and if any of the CPT codes were denied or rejected and why. The billing team then applies this information to the patient's account, either manually or electronically, and the patient statements are generated through whatever system your practice currently has in place. And then those statements are sent to the patients if there is a balance on the account. One thing I want to highlight is that practices should verify that insurance payments and contractual adjustments are applied correctly to the patient's account before statements are generated and sent to the patient. And then to avoid payment delays from patients, the practice should identify a regular and frequent schedule for generating and sending patient statements.
Well, I think our listeners may have had the experience of patients bringing in bills or statements during visits to discuss. And I found it helpful to know the general structure and what information's on those statements or bills. If it's a simple question, then I may be able to address it and answer it. And that's pretty satisfying for the patient to know that their doctor's all over, their care. Of course, if it's a more complicated issue, I of course refer them back to the front desk staff or billing staff.
And we have finally reached step 8, the last step, which is managing payment and collections for your practice. So the practice should monitor the accounts receivable reports that can be accessed through whatever system you have in your practice regularly to identify issues with payments and collections.
So the last point I wanted to make regarding the monitoring accounts receivable, I think is critical, because this was the only way in my example that we were able to find out that there was a problem somewhere in our revenue cycle. And so if you see disturbances or differences that you don't expect, then that definitely should trigger looking into things further.
Now that we've covered the 8 steps within the healthcare revenue cycle, let's discuss a few ways that your practice can optimize its revenue cycle management. The first is to really understand your software's capabilities and limitations. After you have a good understanding of the software, you can identify changes to the current workflow to make it more efficient. It's really important that the practice's technologies help the administrative staff and do not make the process more burdensome. And to do this, practices can speak with the administrative team that handles each area of the revenue cycle to find out if they're happy with the current process or if they have any ideas on how to make improvements. And if your practice decides to implement a new process or technology, make sure to identify errors or roadblocks that could occur at each stage of the transition so that your team is prepared and they can pivot accordingly. And finally, make sure to set expectations for the entire team. Revenue cycle management is an evolving process and it's always changing, so open lines of communication are key. Next slide, please. One of the things I wanted to highlight when thinking about ways to optimize your practice's revenue cycle is identifying better ways that your practice can submit what are called clean claims. A clean claim is one with all the information on it, free of errors and nothing missing. Some steps to submit a clean claim are checking the patient demographic information, entering billing charges with appropriate diagnosis codes, modifiers, units, authorization numbers, and any practice identification numbers that payers require. Also making sure that you have worked with your clearinghouse and payers to understand what information is required for each claim. Once you know the required information, practices can then work with the software vendor to set up required information for each payer within the software itself. So that will indicate that there's an error on the claim if that specific information is missing, and the practice can address that before it is even transmitted to the clearinghouse. And finally, we always want to make sure that we are correcting all errors on all claims before any batch is submitted to the clearinghouse. Next slide, please. The last thing I want to cover when thinking about ways to optimize your practice's revenue cycle is denial management. And I have a few statistics up here on the screen that are quite shocking. We know that unresolved claim denials represent an average annual loss of $5 million, which is almost 5% of net patient revenue. And we also know that the average initial denial rates have steadily increased since 2016 from 9% to 12% by the beginning of 2022. Next slide, please. On the screen's right side is a list of the most common reasons for claims denials that I won't read all of them to you, but I think that these are really important for practices to keep at the front of their mind when they are looking at optimizing their revenue cycle. And so practices can prevent denials by identifying the problem, and you can identify problems by locating the denial code on the remittance advice that you receive from the insurance company. Once the practice has identified the denial reason, work with the revenue cycle management team or your billing staff and implement some denial prevention safeguards specific to your practice and the specific problem that you have identified. This might include identifying clear team responsibilities or revising the current workflows that you have in place. And then finally, sit down with your team and discuss and outline best practices to prevent these denials going forward. And now I will turn it over to Dr. Chen to discuss some practice strategies and long-term success related to the revenue cycle.
Thanks, Taylor, and thanks for all that information. The revenue cycle is definitely complicated, but again, we want to give you a general framework from which to work. So I just wanted to end our presentation by reviewing 3 tips for physician owners and leaders. The first one is I've already talked about multiple times that we don't have to be experts in the revenue cycle, but hopefully this introduction to it will help you start formulating those questions for your own practice. The second point is you want to assemble the right team. So it may be somebody on your staff that's already managing much of that revenue cycle, but you also need to make sure that your expert can answer your questions in a way that's understandable to you and so that you can make decisions for you and your practice. Finally, you want to assess your revenue cycle on a regular basis. Some practices do this annually, some people do it more frequently, but we would probably recommend reviewing on a quarterly basis to balance both diligence and the increased time commitment that it takes. So getting a good grasp of your practice's revenue cycle can be a pretty daunting task. However, if you can get a good handle on it, here are some possible positive outcomes or basically lights at the end of the tunnel. Well, one of the most obvious things is that you'll get increased financial sustainability and stability. And that may allow you to increase investment in your staff, in your infrastructure innovation. You could even maybe pay yourself a little bit more for all that hard work that you've done. But having a good handle on the revenue cycle not only increases the dollars that you may be able to receive, it also helps you adapt more quickly to external forces such as decreased reimbursement rates, et cetera. And it can increase your patient satisfaction because of different transparencies that you can pass on to your patients. Their bills and statements may be clearer if you review the revenue cycle and optimize it. And so that can be a good added bonus to your practice. So on these positive notes, I'd like to thank you all for joining Taylor and myself today. Have a great rest of your day.
Thank you to our speakers for sharing their time with us today. Please visit the discussion board, which is located on the right-hand side of this webinar. That way you'll be able to connect with Dr. Chen, Taylor, and peers on revenue cycle management. We will also be posting weekly prompts. The first one being, what is your biggest pain point in the revenue cycle at your practice? It would be wonderful if you guys could share your responses on that discussion board, and we'll have both Taylor and Dr. Chen logging on to respond. And that concludes our presentation. Thank you all for joining us. I encourage you to check out additional resources at the Steps Forward website. Thank you.